I'm Dr. Elie Isenberg-Grezda. I'm an assistant professor at the Department of Psychiatry at the University of Toronto Faculty of Medicine and a psychiatrist at the Odette Cancer Center here at Sunnybrook Health Sciences. I'm going to be presenting on coping with a cancer diagnosis. I have no disclosures that are relevant to today's talk. I do have a consulting agreement with Celgene USA, unrelated to today's content. For starters, when it comes to coping with cancer, there are a number of different areas that people often describe having to cope with. To begin, there's coping with a cancer diagnosis. People often have to manage the emotions of cancer, learn how to deal with the physical symptoms, cope with life changes that can happen through cancer, try to navigate or re-navigate relationships, encounter spiritual or existential distress, and deal with the after effects in life after treatment. What I was asked to present on today is item number 1, coping with a diagnosis of cancer. So let's begin. Now, this slide might seem out of order. We usually put resources and other references at the end of a talk, but the reason I wanted to put it here at the beginning was to try to highlight a really important point when it comes to managing and coping with a diagnosis of cancer. When being diagnosed with cancer, people often talk about wanting information. And this makes perfect sense. I mean, information really is the foundation for how we understand everything to come. We've all heard the expression, knowledge is power. But information also really has to come from the right places. I mean, there is no one single cancer. There is no such thing as one type of cancer. There are tens, maybe even hundreds of different types. And if we consider different genetic variants, maybe even thousands of different types of cancers. And so hearing about a given individual's experience, their own experience with their own cancer, might not be very helpful to you in particular. In fact, it might not be applicable at all. And so rather than going on random obscure blogs or other obscure websites, we always recommend that people, if they are going to get information online, they go to a reputable site. And here I wanted to list a few. So, that having been said, let's jump right into it. The first thing to keep in mind is that when it comes to being diagnosed with cancer, everybody reacts differently. There's no right way to do this, really no wrong way to do this either. I'll read you some quotes from patients that I've worked with their permission of course, and you'll see just how varied people's reactions can be. It felt like I was hit by a bus, like my whole world came crashing down on me in an instant. My mind was racing, I couldn't think straight. It was like a million things going through my head all at once, and yet I couldn't possibly articulate any of them. What would all of this mean for my life? Does this mean that I'm dying? Somebody else said, I felt completely numb. It's like I heard every word the doctor said. I remember every moment of it, but I had zero emotion. Everyone expected me to feel sad, afraid. Heck, I even expected that. It's weird, for weeks, I never felt sad about cancer. A third patient said, I felt like my house was on fire, like it was a real state of emergency, like I had to decide in that very moment on every decision that would ever have to be made. And so you can see just how varied people's reactions can be when they get diagnosed with cancer. The initial emotional reactions can range from shock, horror, fear, anxiety, all the way through to sadness or depression, feeling overwhelmed, feeling guilty, or in some cases, feeling numb. Let's talk a little bit about waiting. When it comes to being diagnosed with cancer, waiting really is the name of the game. You can see on this schematic on the left side that often people start off recognizing a symptom, maybe a lump or a bump or any other symptom, and they might go see their family doctor or another specialist. They might have some tests done, and sometimes they get a finding that seems like it could be cancer. That often is followed by a biopsy where a certain amount of tissue is taken, looked at under the microscope, and then a definitive diagnosis of cancer can be made. But even after that, people often need more tests. We call that staging tests, in order to try to figure out not only how big the tumor is, but whether it's spread to any lymph nodes or spread elsewhere in the body. And nowadays, there's sometimes even more tests, like genetic testing, that can be done, which can often help the oncologists decide what the right treatment plan needs to be. You can see there's a lot of waiting, and as some of you might already know, it can be really, really terrible for people during this period of waiting. Here's another quote. "This was the worst part of the journey for me. That period of waiting at the beginning, not knowing what the test results would show. They couldn't even tell me if I would need chemo, radiation, surgery. We had no clue how bad it was. I was trying to keep it together for my husband, for my kids especially, but I was terrified. And there was no pill that could take that away. I just had to wait." So people often ask me, what can I do? What can I do during this period when receiving a diagnosis of cancer? And again, while there's no one size fits all and there's no rule book, there are some tips or tricks that seem to be quite helpful. So let's go through them. First, people can find it very helpful to get organized. Here's another quote. "What nobody talks about is just how many bloody appointments they schedule. It's like my entire life became about doctor's visits. Not just doctors, blood tests, scans. I can't even tell you how much I was poked and prodded. I've never kept a journal before, but I knew that if I didn't, I'd never remember all of my appointments. So I started using a calendar in my phone to keep myself organized." Another tip is understanding who's part of the team. Here's another quote. "Suddenly I was part of a huge team of doctors, nurses, there were even social workers to help me apply for disability. It was actually a little bit scary at first, because a whole team walked into the room. But when I realized that I'm actually a part of the team too, it felt like I regained something that I thought I had lost." There are a number of different players that can be involved in the team, and it's really important to understand who they are and what their roles are. A medical oncologist is the type of oncologist that prescribes chemotherapy or other systemic treatments. A radiation oncologist prescribes and administers radiation, while a surgical oncologist is the surgeon that's tasked with removing the cancer surgically in the operating room. There are certain instances where a surgical oncologist might also prescribe chemotherapy, and that really just depends on the cancer type and the setting. Getting informed. You know, they always say to avoid Dr. Google, but I'm a need-to-know kind of person. So I told my doctor, and that's how I found out about the Canadian Cancer Society website and about CNETs. It's like, I'm going to do research, so I might as well go to the right sources. And we can't stress this enough. It's so important to go to reputable sources. It's not that blogs and other sites, whether mainstream or obscure, are necessarily badly intentioned, but they're not necessarily vetted, and they don't necessarily have the type of evidence-based information that you'll get on other more reputable sites. It's really important to ask questions. Here are a few quotes. "The nurses are probably sick of me at this point. I ask them so many questions, but I need to. My doctor asked me how much I wanted to know. I said I wanted to know everything, the good, the bad, and the ugly. I told her I didn't want to know my prognosis. Why would anyone want to know that? She said okay, but we agreed that she'll let me know if I need to worry." You can see that again, there's no one size fits all, and that different people really prefer different approaches when it comes to getting informed and asking questions. Try to be kind to yourself. "I'm just trying to keep a bit of a routine while I'm waiting. Like, what else can I possibly do? So I'm waking up, I'm going for a walk before I wake the kids up, just to have a bit of me time. Otherwise, I just lie in bed and I stew." It's very important to keep a routine. We can't stress this enough. And if that routine happens to involve healthy eating and exercise and spending time with family or other things that you enjoy, all the better. Be kind to others. Here's a quote. "I know she was well-meaning, but come on. I don't need to hear about this diet or that diet. I don't need to hear about a famous doctor in the US who's going to cure my cancer. I trust my doctors here. Like, don't you think that if there was a magic cure for my cancer, I would do it? So I just try reminding myself that it's coming from a good place, but I also think I need to tell her that I don't want to talk about these things. It might be the only way to save our relationship." And so in summary, for most people, a new diagnosis of cancer is stressful. That's exactly how it's supposed to feel. People can experience a range of emotions, and there is no one single right way to feel or wrong way to feel. It's a period of time that's really marked by uncertainty. And given that from a psychological standpoint, uncertainty is really what fuels anxiety, we always tell people to arm yourself with information. It might be information about the diagnosis, it might be information about who the various team members are, the various players. But try to get informed if that's something that's in line with your wishes. And lastly, ask for help. I work at the Odette Cancer Center, where we have a huge resource of psychiatrists, psychologists, social workers, dietitians, occupational therapists, physiotherapists, speech and language pathologists. Ask for help, and hopefully your team can hook you up with somebody who can address whatever the needs are. And finally, do go check out the resources that I put up on an earlier slide. They can be very helpful for people, and those are vetted and reputable sites. Thank you very much.